Ian Patton underwent bariatric surgery 10 years ago before the rise of Ozempic and other drugs.
It was life-saving. It was necessary at the time.
He says he's not sure he'd be here today if it weren't for that surgery, but new medications are offering more options.
We've got a much better understanding of obesity as a chronic disease, how it works, and how we can effectively manage it. So having these new tools is very exciting.
He says eating well and exercising are a good plan for general good health, but
The evidence is very clear. Eating less and moving more is not an effective treatment for any chronic disease, including obesity. Psychological intervention, bariatric surgery, and the pharmacotherapy. So those are the three pillars of obesity treatment.
We continue to see a rise of people living with obesity here.
semaglutide drugs such as Ozempic and Wegovy have been very successful, but Dr. Sean Wharton was part of a research team that recently presented its findings on a new third generation of weight loss drug called Tirzepatide.
We were surprised. We thought that it would be somewhat better than what we're seeing with the second generation weight management medications, more than the 15% range, but we didn't think it would get over 20%. So we saw 22% weight loss with this new molecule, and that was a really big deal because that's an average.
Furthermore, he says the loss is from key areas.
Most of the weight loss comes from the visceral adiposity, so that's a central area in the belly, and that's the toxic fat. That fat causes inflammation and goes throughout the entire body. It leads to type 2 diabetes. It can lead to heart failure and a number of medical problems.
Tirzepatide is approved in Canada for use in patients with diabetes, but Dr. Wharton says patients dealing with obesity and no diabetes must pay out of pocket about $500 a month. In May, Wegovy was approved in Canada for weight loss, and Dr. Wharton believes Tirzepatide will too because of its overall health benefits.
So fatty liver, high blood pressure, heart disease, if it has an impact on those things, then I think that the insurance companies and possibly the government will look to cover it.
There are a few contraindications for people who should not take Tirzepatide, such as those with a family history of medullary thyroid cancer or idiopathic pancreatitis. Pauline Chan, CTV News.